Gravy Health, the pregnancy support.
Hello dear, today we will discuss an interesting topic, hypertension in pregnancy. We will explain to you the types of hypertension in pregnancy and how it may affect a mother and her baby, those who are at risk of developing hypertension in pregnancy, safety of drugs used in treating it and the implication of this condition on your delivery method. But first, we'll start with a scenario for you to have a better understanding. Mrs. Juliet just attended her third antenatal visit where she was informed by her doctor that her blood pressure is quite high even after a second reading. She has never been told that she has high blood pressure before, and neither her parents nor siblings are hypertensive. She doesn't feel unwell and is therefore wondering what's going on. Hypertension, also known as the silent killer, has become quite common in pregnancy, affecting about 6 to 8% of pregnant women. Three common types of hypertension in pregnancy are chronic hypertension. This is when women have high blood pressure, over 140/90 before pregnancy, early in pregnancy, before 20 weeks, or continue to have it after delivery. Gestational hypertension. This is when high blood pressure develops after 20 weeks in pregnancy and goes away after delivery. Preeclampsia. Both chronic hypertension and gestational hypertension can lead to this severe condition, which usually occurs after week 20 of pregnancy. Symptoms may include high blood pressure, visual disturbance, abdominal pain, excessive bleeding, and protein in the urine. This can lead to serious complications for both mom and baby if not treated quickly. Who are at risk? Those that are at risk for hypertension in pregnancy include first-time moms, women whose sisters and mothers had preeclampsia in pregnancy, or those with history of hypertension in previous pregnancies, women carrying multiple pregnancies such as twins, triplets, or more, women younger than 20 years or older than 40 years, women who had high blood pressure or kidney disease prior to pregnancy, women with obesity or diabetes, women who smoke or drink or who don't get enough physical activities, women who had assisted reproductive technology such as IVF. Why is high blood pressure a problem during pregnancy? High blood pressure during pregnancy poses various risks, which include, for the mother, eclampsia, which are seizures with injury to organs, risk of future heart disease, the need for labor induction, which is giving medicine to help start labor, and placental abrupture. This is when the placenta separates from the wall of the uterus. For the baby, preterm delivery, that is birth before 37 weeks of pregnancy, and low birth weight, less than 2.5 kg. The mother's high blood pressure makes it more difficult for the baby to get enough oxygen and nutrients to grow, so the mother may have to deliver the baby early. Is it safe to take blood pressure medication during pregnancy? Some blood pressure medications are considered safe to use during pregnancy, but angiotensin converting enzyme inhibitors, angiotensin 2 receptor blockers, and renin inhibitors are generally avoided during pregnancy. High blood pressure puts you at risk of heart attack, stroke, and other major complications. It can also be dangerous for your baby. If you need medication to control your blood pressure during pregnancy, your healthcare provider will prescribe the safest medication at the most appropriate dose for you. Take the medication exactly as prescribed. Don't stop taking the medication or adjust the dosage on your own. What should I do if I have high blood pressure before, during, or after pregnancy? Now, before pregnancy, make a plan for pregnancy and talk with your doctor or healthcare team about any health problems you have or had and any medications you are currently taking. Keep a healthy weight through healthy eating and regular physical activity. During pregnancy, get early and regular prenatal care. Go to every appointment with your doctor or healthcare professional. Talk to your doctor about any medications you take and which ones are safe. Do not stop or start taking any medication, any type of medication, including over-the-counter medications, without first talking with your doctor. Keep track of your blood pressure at home with a home blood pressure monitor. Contact your doctor if your blood pressure is higher than usual or if you have any symptoms of preeclampsia as earlier mentioned. Continue to choose healthy foods and keep a healthy weight. After pregnancy, pay attention to how you feel after you give birth. If you have had high blood pressure during pregnancy, you have a higher risk for developing hypertension and or its complications after delivery. Tell your doctor right away if you have symptoms of preeclampsia after delivery. You might need emergency medical care. So now, what about labor and delivery? Your healthcare provider might suggest inducing labor before your due date to avoid complications. The timing of your induction is based on both how well controlled your blood pressure is, whether you have end-stage organ damage, and whether your baby has complications such as intrauterine growth restriction due to your hypertension. If you have preeclampsia with severe features, you might be given medication during labor to help prevent seizures. Will I be able to breastfeed my baby? Breastfeeding is encouraged for most women who have high blood pressure, even for those who are on medication. Discuss any medication adjustments you may need to make with your healthcare provider before your baby is born. Sometimes an alternate blood pressure medication is administered. In conclusion, hypertensive diseases are a major cause of maternal mortality. However, careful monitoring and some lifestyle changes can lower your risk of developing complications from high blood pressure. The responsibility of a mother starts from the pregnancy. Have you checked your blood pressure today?
For more antenatal videos, tips, tools, and professional help, kindly visit our website at www.gravihealth.com or visit our social media handles on Instagram, Facebook, Twitter, and YouTube at GraviHealth. GraviHealth, your pregnancy support.